Okay, so hi, evening everybody. I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS, MAMC, MD Pathology, UCMS, President, Hemat-oncology, AIIMS Delhi. Now, firstly, this is a session I know सबसे पहले FMG एग्जाम में काफ़ी गड़बड़ हुई in the sense that the level of the questions that came and everything was grossly unexpected. So this is a session in which we will take care of the exam uncertainties. So before I go further, normally I do not write my degrees. This time I wrote my degrees. पढ़ के अच्छा लगता है, it looks good कि from top three colleges, MAMC, UCMS, AIIMS Delhi, whatever. I am very curious, what do you think the position that we rise to, or the degrees that all of us get, or whatever, are they without any roadblocks? नहीं बचे. All of us, irrespective of our college, all of us, we are medicos, we suffer setbacks. We absolutely suffer setbacks. There are points at which we feel like यार ये क्या हो रहा है. I mean, absolutely. Thanks. Firstly, I had a very nice Nitya. Thank you for the kind words, and very mutual, very mutual. I know we are interacting after a slight long session, and that too on a slightly sober note. This session is a slightly sober session. I do not know how many of you know about the exam that happened yesterday. I will be taking the poll just in 2 minutes. uh, Asif. Okay. So thing is that irrespective of the profit, irrespective of the college, irrespective whether you are in an MBBS or किस मुकाम तक पहुंचोगे, चाहे MD होगे चाहे DM होंगे, all of us suffer setbacks. Now, firstly, I like to know the composition of the group. If I'll, Shaiman, I will just come to the FMG analysis in just 1 minute. I want to know the composition of the group. How and the options are. The first is the FMG aspirants. Ayushi, I hope everybody is able to hear and see me clearly. Please give me a thumbs up. Perfect. So FMG aspirants, next second year MBBS students, next third year onwards. Next is third year onwards. So there is no right answer. So I am marking the answer as D. Nihal, just refresh the page once. नहीं बच्चे, you mistook it. My question is, I like to know the composition of the group. So FMG aspirants, second year students, third year onwards, that is third years, interns, post interns, everybody are in this together. The audio, those of you who are not able to see the audio, or yeah, there is no NEET PG postpone nahi hoga bachche. Just refresh it once. Those of you who are not able to hear me properly or something, just refresh it once and it will be perfectly okay. Perfect. So firstly, those FMG aspirants who gave the paper yesterday, that is day before yesterday or something, that is on 31st August, we have agreed I'll be taking care of everybody. Now, abhi tak the butt hurts. This is, we sat for the paper on 31st August, but the butt still hurts. And it is not only because the exam was of longer duration and stuff, but totally screwed. Absolutely no doubt about it. I am under no circumstance, take my words for this very clearly, I am under no circumstance supporting the NBE on this. But, bache, there is a huge but. But the exam setters are always the kings. That is, we cannot do anything about it. I am saying this very bluntly. For the FMG aspirants, the PG aspirants, they know it well. I do not believe in sugarcoating my words. Nobody, absolutely nobody can guess the December exam pattern. Nobody can guess the December exam pattern. Firstly, next point, do not be under the false hope कि protest करने से या यार देखो, there are various phases if something bad happens. I'll tell you slight history. Dr. Parvinder Lal, he has been made the director of NBE. uh, I know. He is Professor HOD. He was Professor HOD surgery. I in MAMC. I gave my paper in 2009 in MAMC. I share this pretty often with students. In 2009, we were a batch of 180 students in the second best college all over India. Best is AIIMS Delhi. Second best is MAMC. Out of these 180 students, 105 students got a supply. सबको सप्ली दी थी सब लोगों को. And we were at our wits end यार, क्या करें ना, मतलब फाड़ के पढ़ाई करी थी, सब कुछ करा था, बट 105 सप्ली आई थी. दैट वाज द फर्स्ट टाइम इट हैपेंड. वी वेंट एवरीवेयर कि द एग्जाम वाज क्रेजी, द मार्किंग स्कीम वाज क्रेजी, रीवैल्यूएट करो, कुछ भी करो, कुछ भी नहीं हुआ. वी वर इवन अफ्रेड टू गिव अवर पेपर फॉर रीवैल्यूएशन कि कहीं ऐसा ना हो कि जो द वी वर सो अफ्रेड. यार प्रत्युत, we wanted a review, but we were so afraid. We were so afraid कि कहीं repeat supply लगा के, because MAMC supply is not a big deal. You give the paper again in 2 months and your life is set. But if you get a resupply, you lose 1 year. So we were afraid to even give the paper for a reevaluation. So we did not. We talked with dean. We talked with everybody. Nothing happened. We sat for the supply exam, and all these 105 students, including me, I also got a supply, and all of us are doing pretty comfortable in life at present. So no doubt about it. I'm sharing this very frankly on a public forum which is being recorded. No doubt, all of us are pretty comfortable. So one stupid paper, one stupid exam does not define you. First point. But we need to correct our thought process over this. It will take time to wrap yourself around this fact कि यार इतना crazy paper आया था. So problem is not the pattern. They did not inform. I totally agree, Imani. I totally agree. But that is the specialty of Dr. P. Lal, na? NB was, I know उसने ऐसा करा है, दोबारा ऐसा हुआ है. Plus December exam की uncertainty है. That is the biggest, na? That is the biggest key. December exam is uncertain. If you ask me as a faculty, ki, sir, what should we study? Should we study the single line questions? Should we study the clinical pattern approach? Should we study the integrated approach? What should we do? What should we do? Frankly speaking, I will ask you to go for the lower two, because if your concepts are right with clinical pattern and integrated, single liners बचे हो जाएंगे. So पढ़ना पड़ेगा. I am not going to sugarcoat it. No faculty at this point can tell you this with certainty. Mock paper was single line. I agree, bache. The mock questions given were on the usual set pattern. But right now, if you have to do this is a trailer for next exam. This is an absolute trailer for next, and you cannot do anything about it except up your game. This is nothing more than that. कुछ नहीं कर सकते, कुछ भी नहीं कर सकते. I know, said very bluntly. Ashmita, yes, बच्चे, because I will be taking care of everybody. थोड़ा FMG exam में ज़्यादा गड़बड़ हुआ था, because this was the FMG 31st August paper. So I have started with the FMG students. Next point. So at this point, there is absolutely no difference between an FMG aspirant or a PG aspirant. There is no difference in the level of the paper. So get this out of the head. From this point onwards, from this point in our discussion onwards, there is no FMG exam There is no FMG aspirant. Whatever we will be talking will be will be common to everybody, because you have to do it that way. We'll come nothing super specialty nahi yaar, not super specialty. So from this point onwards, uh, we'll come to that. AIIMS and NEET, they are very closely related to each other. We'll come bache. Let us, Sushrita, so let us start with what to do. For Let us start with the AIIMS November discussion. Now, firstly, you very well know कि September शुरू हो गया है. September, October, November. You have 3 months to go for the AIIMS November. Broadly speaking, September, October, not even 3 months. Actually, 2.5 months to go for the November AIIMS. The December FMG exam will be somewhere in the first or second week of December. Third week पे भी हो सकता है, but target finishing your syllabus by the first week of December. September, October, November. So again, 3 months, 1 week maximum. 3 months, 1 week. And the NEET exam, there is September is in बचे September, November AIIMS, even if it is postponed or something, तो होगा नहीं. Ayushi, winter AIIMS new pattern or the June pattern? New pattern. AIIMS will be on the new pattern totally. AIIMS will be on new pattern until they tell you in the prospectus कि just one best liners will be there. Maruti, I'll come to that. Next is the January NEET exam. Which is FMG aspirants cannot write AIIMS without first clearing your MCI exam. Ankit, you cannot because the stuff is evaluated. What should we prepare? That is what Sojanya Bache, we are coming to the discussion. We are coming to what to study, but first we need to know how much time is there for giving your paper. Now, first week of January NEET is on first Sunday of January. As a result, you have September, October, November, December. So approximately 4 months, 1 week to go for January NEET. This is the time span that you have. Firstly. Secondly, the subjects are extremely volatile. You need to revise everything twice before your exam date. There is absolutely no doubt about it. You have to revise it twice before your exams. Next, you cannot afford to leave a subject. Now, many students, especially from the FMG, had messaged कि sir, the cost of the paper was drastically high. Many students came from Nepal. There were 20 images of derma. The breakup of the paper was, the subject-wise breakup was not adhered to. Everything was haywire. That was true. The subject breakup was absolutely not adhered to. Medicine had close to 50 to 60 questions. Path had 40 questions. Derma, radio was given too much of importance. No doubt about it. But one thing is certain that जितना bleak हम लोग अभी सोच रहे हैं कि result will be less than 5% for FMG and stuff, इतना बुरा result बच्चे नहीं होगा. There is absolutely no doubt about it. Because of Corona, they will be passing more number of students. So let us hope for the best, but prepare for the worst. I always follow the strategy of BSTS, better safe than sorry. I always follow this BSTS, better safe than sorry. We have to prepare for the worst. डर बहुत है ईमानी. I know that यार ग्रेस मार्क्स का फंडा MCQ पेपर में नहीं होता. There is no concept of grace marks in an MCQ. How can we prepare? You have to do new stuff, bache. So there will be in these 3 months close to 70% of what you will study will be the new stuff. Because till now whatever you have studied or whatever you have done was not sufficient, firstly. Secondly, let us first start with the images wala portion. A very common mistake that especially FMG aspirants do is that they do, with the minute images are being discussed, they tend to give up. The same of course will not be for the PG students, but this paper was an indicator for the PG students also, that we are expecting more number of images from the images even in AIIMS as well as the NEET January exam. If this paper was any indication, we had 70 images in on the 31st August exam out of 300. Average number of images that are asked in FMG are about 8 to 10. That is the average. That number was increased to 70 images. So I have not gone, if but even I have not gone through the FMG exam paper because the recall level of the, it was the first time in FMG exam that the questions had 8 to 10 lines. The clinical history was given and stuff. So the recall is very low. Next point for the images, guys, let me slightly streamline the, I'll take care of all the queries. Sucharita, Phil, I'll take care of you, but let me slightly streamline. For the images we are having a totally complementary course on the visual image discussion, which will take care of all your 19 subjects. Each subject will be given a duration of 1.5 to 2 hours, and this course, of course, the AIIMS aspirants and the NEET PG aspirants, but you have to do this image based discussion, no doubt. For the FMG aspirants, close to 90% images in this discussion will be new for you, but you have to sit in this discussion. चाहे समझ में आए चाहे ना आए, you have to sit the first reading. It will feel like what is going on, but the first time you have to listen to them, see them, and do it. It will be on the Unacademy app only, bache. It will be totally complimentary for everybody. All 19 subjects will be taken care of. Next point, that will be conducted in the third week of September. That will be in third week of September. In this will be over a span of 4 days, 4 to 5 days, with 6 hours of discussion per day. 6 hours of discussion per day. So I want everybody to sit for this visual image based discussion, and firstly promise me this, that you won't give up in this visual image based discussion midway. Nahi bache, I will be taking care only of pathology. There will be 19 subjects. The NEET pattern is to NEET, or the AIIMS pattern is totally different. I know in FMG one faculty teaches 2 to 3 subjects, but that is not so in the AIIMS or the NEET pattern. Everybody will be a MD or a subject faculty of that particular subject. So 19 faculties will be taking this. Next point. Sushant, Dost, if it was in my hands, I could have conducted this day after tomorrow only, but it takes time. So it will be in the, we can do it at second or the third week of September. You will be given the final dates, but everybody should be sitting in this. That is, this will take care of your images portion. First point. Next, you have to keep your thought process very straight. Keep your thought process straight. Bache, the first example, I'm glad I wrote this at this point, because you are thinking of firstly, Nabina, nahi bache, no subscription will be required. This is a complimentary or a free course for everybody. No subscription will be needed for this. Now, coming to keeping the thought process straight, because many students are of the thought process at present ki yaar totally lag gayi, या they have given up, या protest करेंगे और बहुत difficult हो रहा है. Even the NEET PG aspirants or the AIIMS aspirants, or everybody for that matter, this is the time. What they do is they keep on reading, or the students, even the AIIMS aspirants, they will be reading new stuff at this point. But you have to put a deadline for reading new stuff. You have to put a deadline for reading new stuff. Firstly, this means this is exclusively for the PG aspirants. That is, you have to finish your syllabus. maximum by second week of September. No doubt about it. इससे ज़्यादा extend मत करना. This is for the PG aspirants, because the first revision will take approximately 6 weeks. uh, Shweta, you will have to do it, bache. There is no doubt. I'll tell you why. First revision will take you 6 weeks. Doing MCQs of previous 3 years, doing at least 3 साल के MCQ तो करेंगे, will take you at least 4 weeks. If you finish it by then, by the time you will appear for November AIIMS, उससे एक महीना पहले तो वैसे ही कुछ 1 week पहले वैसे ही पढ़ना ही थोड़ा मुश्किल होगा. As a result, the end point has to be second week of September. Firstly, Nithya, I'll come to the renal quiz. It is on 6th September. Ankit, just refresh the page once. There is absolutely no lag from my side. It will be okay. Now, Shweta, this is one of the most common query that the students have, that can't recall. First query is can't recall. Second is ki even if we have read it once, can't solve the MCQs on the basis of theory. Third is how to spend the time. This is true for both bache, whether you are an FMG aspirant or a PG aspirant. These are common queries. The material to follow. You are being bombarded with material. There are 6 apps at present. You have your notes with you. You have done live coaching from somewhere else. What is the material to follow? Let us take all these questions one by one. I know, bache, the yes, another query is the time management. So many students, both even in the PG segment as well as the FMG segment, this time at least, out the last 20 minutes, I'm sure the FMG students would have marked around 20 questions or so. The time management was lagging. The NEET PG exam which occurred, this NEET PG 2020, the questions were lengthy. Each question had about 10 to 12 lines. The whole essays were written and stuff. And after that, you were asked to come to a diagnosis or the next line of management or something. These are the common problems that both FMG from now onwards and PG aspirants have always faced. So there is absolutely no doubt, no difference between two sections at present. First of all, believe in yourself. You have a subconscious mind. When the options will be there, you will be able to recall it after seeing the option. Firstly, you always know more than what you think. There is no doubt about it. Secondly, first choice, Himani, actually, I never believe in marking the first choice. It is, I have become a doctor, I guess, by marking the option C. If I don't know anything about it, had se had, I will go for B, but nothing else. C will be always my first choice. So I agree, Indrajit, all of us have become doctors by this only. One-liners to degrees, of course, bache, for the PG entrance Weber, one-liners will be negligible. For FMG, it is very, very hard to comment, but I will not be basing too much of my hope on one-liners. Nahi aayenge yaar, one-liners nahi aayenge. Next, can't solve MCQs. For that, I always ask the students, at least after the first revision, to divide your time as 60-40. That is 60% of the time should be for theory versus 40% which has to be given for MCQs. So if you are sitting for about 10 hours in a day, give 6 hours to theory and 4 hours to MCQ. This is time tested. This is what my seniors told me, and this is what I am telling you. Material to be followed. Stick to your one source. Do not fall into the trap of FOMO. FOMO is the fear of missing out. FOMO is the fear of missing out. And they'll just come to the main subjects. There is absolutely, do not fall into the concept of FOMO. Ki let me do some topics from here, some from here and stuff. It will all get mingled up. lone wolf nahi bache joining the another thing. I'm glad you asked me about joining the hospital. Even those PG aspirants who are working, especially the post interns, please stop working, dedicate yourself fully to studies. This is because the books, the apps, whichever book that you are reading, I'm not asking the MCQ books, let me add one word here, the MCQ books. There is absolutely no way that you can start reading Harrison, Robbins, even forget Grey's Anatomy, even BDC at this point, or Genong or whatsoever. There is no way that will be disastrous. Those of you, this is holding true for the PG aspirants also. Those of you who are doing books at this point, thoda sa gadbad hai. Treatment management, nahi bache, does not depend on the examiner's viewpoint. There are standard WHO guidelines for treatment management that absolutely does not depend on the examiner's viewpoint. So for the images, Ram Bhakt nahi dost, for the images, if for the images also, we as faculties will, that is what I told you, for the image based discussion, in this 5 days you will be seeing close to 500 to 600 images. पहले ये तो देखो, उसके बाद we will see what is to be done. Next point, follow the PG MCQ books. This is for the FMG aspirants. PG aspirants will all obviously follow the PG MCQ books. FMG aspirants, please follow the books which are read by the Indian students for the PG exam. This is because the questions are being framed from that. This paper that you had, all the questions were from the PG MCQ books. Those of you who are following an app, stick to your app. If you lone wolf, bache, simple, I mean, because of conflict, some PG MCQ books. Okay, so let us, the easiest way to do this is go to the bookshop and ask for हाँ बच्चे, all the classes Himanshu with respect to the image based discussion will be 5 to 9 p.m. or 5 to 10 p.m. Next point, go to the bookshop and ask for the bestsellers. With respect to the PG MCQ books, there are just 1 or 2 books per subject. Because I am on a platform, I will not be able to name the books, but simplest funda is go to the bookshop and ask कि यार PG की जो subject तुम बोलोगे उसकी book बता दो. 2 ही books आती हैं PG में हर subject की. Next point, target your studies in such a way that you are able to finish a particular module in a particular time bound format. So when you make a schedule, it should be a detailed one, and stick to that schedule. I'll give you a very small example. Like for the second years and third years at present have ample time. So I have kept an integrated nephrology discussion on 6th September. So I want everybody to finish off nephrology, especially the second years and third years, from both pathology as well as medicine, before your 6th September, so that you have a look at the integrated discussion. For the interns, but you do not change your schedule to match the quiz. For you, the best part is if you have already covered kidney, suppose you've already covered kidney, this quiz will be an eye opener, or it will tell you how good your recall was. So this is how you have to go forward. नोट्स करते हुए बहुत टाइम लग रहा है, डेफिनेट बच्चे करना तो है ही. हाउ मेनी आवर्स, सी that is where the thought process will come into mind. When everything is going wrong and things seem to fall apart, nobody believes in you. This is a fact. One of the biggest problems is what will we tell our parents after after the result and stuff. Next, Nabin, I'll just come to next pattern in 1 minute. You have to believe in yourself, and you have to start early. No doubt about it. Next point, Sudhanshu, before I take your question, I will I'll take care of the next pattern. The next pattern, this will be applicable for all the current second years, all the current third years, especially the FMG aspirants to second and third year may, because January 2022 will be the next pattern. NEET will not be conducted, or NEET will be only for the interns at that point. So in the next pattern, there will be paper on 3 days. Nitya, bache, we will see now. We will see. Abhi let that 6 September come. If more time is needed, we will see that on 6th only. Next pattern, the paper will be conducted on 3 days. Day 1 will be medicine plus allied subjects, medicine plus allied, which will have 120 questions, plus peds plus allied, which has 60 questions. Day two will be surgery plus allied subjects, same 120 questions, plus optha plus allied, which will have 60 questions. Whereas Nihal, but the quiz will be on Unacademy only. The link of the same will be there on my Telegram group. Last day three will be obs-gynae plus allied, which will be 120 questions, plus ENT, which will have 60 questions. Charvi, I'm just coming to allied, bache. Let us start with medicine. Medicine allied is path pharma. Bit of micro. Surgery allied is ortho, radio. Medicine allied also includes derma. Next, ortho, radio, and anatomy, upper limb, lower limb, abdomen, thorax. Optha, 60 questions, plus allied is anatomy, eye. Peds allied. हाँ बच्चे, Indrajit pharma allied है ना, because path, pharma, derma, these are the allied subjects with medicine. Obs-gynae allied is again anatomy, pelvis, whereas ENT allied is anatomy, head and neck. So anatomy को चार types में divide कर दिया and 2 days में divide कर दिया. That is how the integrated questions will be framed. The total number of questions will be 180 into 3, that is 540 questions. You will be having 180 questions on each day. This is the next pattern. This will be totally an integrated approach. So let us have a look. Bache, biochem, physio will be allied of medicine. They will not be asking you a straightforward physio question कि lung का forced vital capacity कितना होता है, FEV1 कितना होता है. Those will not be the questions. The questions will be applied that you need to know normal FEV1, FEV2, and then a question on obstructive lung disease has been framed. That is pathology, and the treatment of the same is asked. That is medicine. This is how the integration of the questions will be there. Next point. Now, firstly, at this point, for the PG aspirants, I'll just first take care of the PG aspirants. But 10 days to go. After 10 days, you have to stop reading subject-wise. There is no doubt about it. After 10 days, that is maximum from the second week of September, start your revisions. Start your first revision. Do a test and discussion. This is for the PG aspirants. Do test and discussion or do a crash course and divide your time 60-40 as we discussed. Firstly. Next point, after this, do the previous 3-year questions, at least previous year questions, go and give your November AIIMS. Between November AIIMS and January NEET, you have to revise all the subjects once more. So one revision will be there, and take my word for it, you will get through if you follow this schedule. Firstly, this was for the PG aspirants. For Susharita, I can talk about the Unacademy app very comfortably on this, as well as the prep ladder. The AIIMS targeted crash course being launched by all the subject faculties, as well as we are coming up with a crash course for NIMHANS. So NIMHANS, those of you, I know less number of students give it, but NIMHANS, the examination is based on neuro. So it will have 6 main subjects. that is neuroanatomy, neuropharmacology, neuropathology, neurosurgery, neuromedicine, and neurophysiology. So these two courses will be there. Nihar, yes, all, or let me rephrase, majority of the sessions on an academy will be in an integrated manner. Next point. This was for the PG aspirants. This was for the PG aspirants. For the FMG aspirants, nahi bache, Nihar, the number of complementary sessions will depend upon the management. I mean, I cannot commit to a number right now sitting here. So I can only commit to what is in my hands. For the FMG aspirants, firstly, you have to, when all these bache they have started, Nimha's course, I guess, will be active from the second week of September. From the second week, AIIMS targeted course has already started. Personally, with respect to pathology, I started it in the second week of August, along with Robin's updates. Individual faculties would have started it. Everybody would start it maximum by the first week of September end. That would be the last date when everybody would start the AIIMS targeted course. Next point. Now coming to the FMG aspirants, first thing is you have to unlearn what you have learned till now. Unlearn what you have learned means, Loan, I'll come to your point. Unlearn what you have learned means you have to remove the mental block कि यार हमें इतना आता है, इतना कर सकते हैं, इसके ऊपर करना मुश्किल होगा. You have to totally remove that mental block. Many students have this mental block कि सर 6 years हम लोगों ने ज़्यादा reference textbooks नहीं पढ़ी. Now what to do? These 3-4 months, forget everything. Sit on your chair for approximately 10 to 12 hours per day. Put your personal life on a hold. If you are a couple, if you have a girlfriend, fair enough. Do not break up. If you do not make a new crush. If you are sitting for 10 to 12 hours, bache, your output, that is the effective study time, will be approximately not even 10 hours, will be actually approximately 8 hours. For till the time you are not done with reading your first time all the subjects, divide your time as 6 hours of videos. Already Feb से होल्ड पे है इंद्रजीत, माय कंडोलेंसेस, बट जब तक ये वाला पेपर नहीं निकलेगा हम उसे होल्ड पे रखेंगे. अंकित, बच्चे मेरे पास क्वेश्चंस ही नहीं है. आई मीन इफ आई वुड वेरी ग्लैडली I'll write my personal WhatsApp number also. This is my personal WhatsApp number. You can search me on Telegram. You can send me a personal message on Telegram. But for pathology, I need the recall questions first, and I do not have good recall questions because the students are saying कि सर इस टॉपिक पे आया था या ये ऑप्शन थी बट क्वेश्चन ही नहीं पता क्योंकि क्वेश्चन लंबा था. Next point, August did not have much general path, not at all. I'll come to that. Question was like they want to repeat an exam. Okay, so till that time you are not done with your first reading, you need to watch 6 hours of app or video lectures. नहीं GV, I have not talked about MLE yet बच्चे. For the first reading, जब तक फर्स्ट रीडिंग खत्म नहीं होती 6 घंटे तुम्हें वीडियो लेक्चर देखना है. जो चीज तुमने उसमें पढ़ी है, फॉलो इट अप विद MCQs. Do avoid watching the sessions which are pre-recorded. I am writing this very clearly for FMG. Avoid watching pre-recorded sessions of FMG. This is because जिसने भी pre-recording की है, that pre-recording has been done on old format. You right now have to study according to the new format. Bache, if you are watching the PG part of prep ladder, that is absolutely okay. But if you are watching the FMG portion of prep ladder, the content would be slightly diluted. No, iconic subscription, if you take, go for the PG portion. Iconic subscription will open up everything for you on prep ladder. What I am saying is read the PG portion. There is absolutely no concept of FMG exam at this point. That is what I am trying to grill in you. So your old notes of FMG, irrespective of whichever coaching you attended, your old notes of FMG will just be your stepping stone. They under no circumstance are complete. I cannot say this more bluntly. They are under no circumstance complete, you including mine. Let me add this word. I take like classes in 3 coaching institutes, including mine, because bache, they are the stepping stones at present. Next point, you have to upgrade yourselves to the PG level. Secondly, after you are done finishing reading all your subjects for the first time, so you have to finish maximum by first week of November. क्योंकि अगर first week of November तक खत्म नहीं किया तो बच्चे रिवाइज नहीं कर पाओगे. You need at least 2 revisions of the notes. Clinical questions बच्चे निहार. If we are talking of the PG preparation, everybody, Unacademy, Pleb Ladder, everybody are integrating the questions and they are on the clinical pattern only. So if you are going PG notes khatam karne hai GB, now your question is it possible to finish before December? You are saying December, I am saying first week of November. This is because agar khatam nahi kara, let us assume ki khatam nahi hue, and you go and give the December exam, which is again on the new pattern. What will you do now? Firstly, निखिल, बच्चे मैरो पीजी एस्पिरेंट्स का खत्म नहीं होता जो 1 जनवरी से शुरू करते हैं. मैरो पुट्स इन एवरीथिंग 3 महीने में कैसे करोगे? go for live classes as the content can be modulated that way. Firstly, secondly, the major subjects for FMG. Now I am very much hesitating while writing the major subjects, but bache obs gynae, peds, medicine, surgery, path, pharma, ये तो मेजर सब्जेक्ट्स हैं ही हैं. There is absolutely no way you can leave any one of these subjects. Next, अब की बार PSM. Yes, how could I forget PSM? This time even radioderma became major subjects. But my very sincere advice to you will be, do not put in, I mean, you have to study them, there is no doubt about it, but do not think that so many questions will be repeated in December out of radioderma also. We are not expecting that. So radioderma will have their usual 5 to 6 questions, not 15-20 like they happened this time. So first start with your major subjects, do them extensively. Next point, कहाँ से पढ़ना है? Now I can easily talk about the Unacademy platform here, in the sense that with respect to Unacademy, all the FMG batches and the courses we have started from 1st September. The schedule that we have made is in such a sense that the classes are back to back. You will be having 6 to 7 hours of live class every day. Live class बच्चे करनी है. What happens is recorded lecture ना सुनना दिक्कत हो जाती है. अगर कोई तुम्हें बोले कि 7 hours का recorded lecture सुनना है, that is crazy. We will not be able to listen to that. But if it is a 6 to 7 hours of live class, the faculty will engage you. So you have to sit and respond in the live class. Yes, bache, everything is according to the new pattern, because that is what we are expecting in December. So attending live classes will be a headache. You will feel like giving up at numerous times. You will feel like यार recorded session available है, PDF available है, इसको बाद में देख लेंगे, रात में देख लेंगे, but वो बाद कभी आता नहीं है. Next point, general segment of path and pharma fill नहीं. There is no concept. There is no concept of an FMG oriented course at present. Everything is the same at this point. This paper has taught you that the hard way. So why do you want to study something lesser and hoping for the best? थोड़ा गड़बड़ होगा ना, गड़बड़ होगा. I mean, I hope from the bottom of my heart that the December paper is on the older pattern and it is easy, but me or you hoping won't change the reality of the same. Next bache, definite saying with respect to the NEET PG courses, there are 3 targeted courses: the AIIMS crash course, that is exclusively AIIMS oriented, the NEET PG, the NEET and the NIMHANS crash courses. At this point, you have to do questions in the T&D format. For the PG aspirants, you have no time to do anti-grade reading. So everything is in the crash course or the test and discussion module. The courses being launched are totally separate. They are totally separate. Done. So all the joining NEET PG will be helpful for NEET. Yes, yes, Himani. All the courses at present will cover everything. I mean, the new pattern is similar, and they change that. Aman Fatima, if you are studying more, new pattern is always more. If you are studying more and a easier level question comes, chances of marking it right are drastically high. But think of it the other way around, that you are studying the old pattern and the new pattern question comes. What are the chances of marking it correct? Negligible. Negligible. So many students, I am very blunt. I mean, do not mind this fact, but I am grossly blunt. I do not know how to sugarcoat my words. So many students told me कि sir जो 6 line का question था, after reading the first 2 lines we forgot कि ऊपर क्या लिखा था. एक्सरे दिया था, बायोप्सी इमेज दी थी, ऑप्शंस दी थी, जब तक पता चले टाइम भी बीत गया. You have to study for the new pattern, and this actually happened because see, the mind knows what we are trained for. You guys were not trained for this. Which live class, Margaret? That is what I have said, bache. Start with the major subjects. Start with the major subjects. On Unacademy, we have started it from 1st September, and you will be having, it will not be easy. I'm saying this very, very frankly. Attending so long live hours of classes won't be easy. They won't be easy, but you have to do this. The name of the course, bache, is the FMG. The course has the word FMG in it. I do not know the exact name. Yeah, it would be the full course for FMG or something like that. But of course, previous year papers will be done. In the Jeep, there are not many bache. When you are asking me the name of the course, it started on 1st September. No, it started on 1st September. I have my second class today at 8:05 p.m. I have my second class today at 8:05. The course has started. The course has the word FMG in it. That is full revision course for FMG. It is something named like that. There is full revision course for FMG. So the first day was yesterday. Today is day 2. All the recorded videos are available, but attend live classes. That is what I am trying to say. Last point. हाँ बच्चे, for I will be doing a crash course for AIIMS and NEET exam, which will be complimentary for all the 4 hours. I'll be doing a crash course for FMG subscription, complimentary for all, that is 4 hours. But the whole course, which will be for 44 hours with respect to pathology and everything, for that subscription will be needed. Direct things from notes not to be expected. नहीं बच्चे, नहीं Sushant, vibe session is totally free. Vibe session of all the subject faculties, all 19 subjects, all 5 days. All 5 days is completely complimentary. For vibe session, you will not need any subscription. Done. Vibe is the visual image based discussion, bache. Vibe is for that visual images. Sushant was asking about the visual images, the one we discussed over 5 days. That was what Sushant was talking about. Last point. I am writing my personal WhatsApp number. I will be glad if somebody can send me the original or as authentic as possible the pathology questions which came in this exam. MCQ pattern, हाँ बच्चे, live classes plus MCQ PG pattern will be more than sufficient. Absolutely no doubt about it. Lone Wolf, you can study under his guidance. There is absolutely no doubt about it. Absolutely no doubt. And in case of any queries or something, I am just a message away. So do not hesitate. Do not hesitate for the same. Lastly, all I can say is our mind acts as an enemy if we do not control it. This actually is true. The thought process after giving the paper will be totally haywire. It will be haywire. Our mind will play games with us. You have to control it somehow. Uh, of course, Weber, if you are talking with respect to FMG exam, close to 60% content will be new. If you are talking with respect to AIIMS or the PG exam, approximately 8 to 10% content will be new. That is the 10th edition Robbins updates will be included. This will be the percentage of new content with respect to pathology. A Webhub, that was for you. And Phil, bache, you have to do this. I know it will be hard to shift from FMG to PG. Think of it this way. If I put 60% new content, even to my old students for the FMG exam, it will be tougher. As such, my classes in FMG were always on the tougher platform. I mean, I never did superficial. I went too deep and they were integrated questions and stuff. So it was always on the tougher level. Still, I am saying that 60% content will be new. So think of it as that those classes which were at much more superficial level, their new content will jump to about 80%. Next and the last slide from me today, and this actually is new. This actually is a fact that कोई भी बुरा वक्त ज़्यादा नहीं टिकता, पलट जाता है. So have faith on your hard work. You have to beat your minds. Visual image based, yes Ritika, that was the visual image based. Done, bache. This was just a talk that I wanted to have with you guys. It was nothing. It was not. There were no pathology questions. There were no content. But this talk was needed, and I wanted to interact with you today. On 6th September, we will be having a nephrology quiz. 6th September evening only. We will be having a nephrology, that is a quiz on kidney. Now, all the FMG aspirants, you have to attend everything that is for PG. Of course, the questions will be AIIMS oriented. All the questions will be AIIMS oriented, so there is no distinction now. Sammy, the one batch started on 1st September. The second will start on 5th September. Bache, why do you want to lose out on these 4 days now? That is what I'm trying to tell you. The content will be the same, everything will be the same. Why do you want to lose out on these days? The faculties will be the same. Only difference will be what I have taught in this 4 days. You will be listening to it later, or the classes will be rescheduled. Start early, join early. We'll send you the paper soon. Ritika, thanks, bache, because I need to have the paper. I don't have the recall questions of pathology. AIIMS, NEET, JIPMER, I always do all the recall questions because the aspirants are used to that. So AIIMS, NEET, JIPMER, all the recall questions, everything, they are on the YouTube sessions of mine and stuff. And they're authentic recall questions, but I do not have them for FMG. So I'll be very glad if you can send that. Aman Fatima, bache, the courses are modulated in such a way that you will know. We will have a separate session of the same because I have to start my next session in just 3-4 minutes. Which subject FMG should start physio? Start with path now. Start with pathology, pharma. Start with path, pharma, go to medicine. These will take care of your 3 major subjects. Share the link on of FMG new course in chat, which I cannot share the link in this chat box, but I will send it to you on Telegram. In the Jeet, I'll send it to you on Telegram late tonight because I have to start my session in about 5 minutes. Be happy. That is what bache, integrate all the sessions which are taken new and live are on the integrated approach only. Done. As usual, a pleasure interacting with everybody. Make it a promise कि especially the FMG aspirants कि आज रात को we will clear our mind and irrespective of the result we will start studying within a day or two. That is all I want to say to everybody. Done, and bestest of luck and take care.